The pectoral region is the anterior region of the upper chest, where there are 4 thoracopendicular muscles. These muscles are covered by fascia. Let's talk about what is fascia in some more detail. Fascia is a thin casing of connective tissue that surrounds and holds every organ, blood vessel, bone, nerve fiber, and muscle in place. The tissue does more than provide internal structure. Fascia has nerves that make it almost as sensitive as skin. When stressed, it tightens up. There are 2 layers of fascia in the pectoral region: deep and superficial fascia. The deep fascia covering the pectoralis major muscle is called the pectoral fascia. The superficial fascia of the pectoral region is visualized after the skin has been incised. It contains moderate amount of fat and is continuous with that of surrounding regions. In addition to fat, the superficial fascia of the pectoral region contains the following: cutaneous nerves derived from the cervical plexus and from the intercostal nerves, cutaneous branches from the internal thoracic and posterior intercostal arteries, the platysma. The breast. We will discuss the anatomy of breast in detail now. The breast, which is well developed in females, is the most important part of the pectoral region. The breast lies in the superficial fascia of the pectoral region. It is divided into 4 quadrants, as you can see here: upper medial, upper lateral, lower medial, and lower lateral. A small extension of the upper lateral quadrant, called the axillary tail of Spence, passes through an opening in the deep fascia and lies in the axilla. Vertically, it extends from the 2nd to the 6th ribs. Horizontally, it extends from the lateral border of the sternum to the mid-axillary line. We will talk about the basic structural features of the breast, as well as lymphatic drainage. The breast is found in both sexes, but is rudimentary in the male. It is well developed in the female after puberty. The nipples are small and surrounded by colored area called as areola. Here a system of ducts is embedded in connective tissue that does not extend beyond the margin of areola. Each breast consists of 15 to 20 lobes, which radiate out from the nipple. Here we have a diagram of breast showing its anatomical structures. Here you can see the rib. Next is the pectoralis major muscles and a layer of pectoral fat. The lobes of mammary that are only present in females are labeled here. The nipple and areola are present at the surface. We also have the lactiferous sinus and ducts present just behind the nipple. As for the vascular and the nerve supply of the breast, it is supplied by the branches of thoracic and axillary artery. The nerves that innervate the breast are anterior and lateral cutaneous branches of the 4th to 6th intercostal nerves. You can visualize the borders of breast with the help of this diagram. Borders. The breast has 4 borders: anterior, posterior, medial, and lateral. At the anterior border, there are 2 muscles present: pectoralis major and pectoralis minor. At the posterior border, we have the scapularis, teres minor, and latissimus dorsi muscles. At the medial border, serratus anterior and thoracic wall are present. As for the lateral border, we have the intertubercular sulcus. That concludes the location and description of the breast. Now we will talk about the lymphatic drainage of the breast. Lymphatic drainage of the breast assumes great importance to the surgeon because carcinoma of the breast spreads mostly along lymphatics to the regional lymph nodes. The lymphatic drainage of the breast comprises of lymph node and vessels. The lymph nodes of the breast are supraclavicular group, apical group, anterior axillary group, central and lateral axillary group, and internal mammary group of lymph nodes. The axillary lymph nodes, chiefly the anterior or pectoral group. The posterior, lateral, central, and apical groups of nodes also receive lymph from the breast, either directly or indirectly. The lymph from the lateral quadrant drains into these nodes. Lymphatic vessels. The superficial lymphatics drain the skin over the breast, except for the nipple and areola. The lymphatics pass radially to the surrounding lymph nodes, axillary, anterior thoracic, supraclavicular, and cephalic. The deep lymphatics drain the parenchyma of the breast. They also drain the nipple and areola. You can check out our video on breast problems in out differential diagnosis clips to learn more about the examination of breast, as well as clinical questions that you need to ask the patient in order to rule out any breast problem. Next, we will be discussing the muscles of the pectoral region in detail.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.